A neighbourhood volunteer group in Madrid. Many Spaniards ran errands and organised food for those in need during the pandemic. They were honoured by the EU Parliament for their efforts. Welcome to the COVID-19 Special Report. Long COVID can lead to severe mental health problems. We talked to psychiatrist Leo Scher about just how severe and why. Plus, how dangerous is the so-called twindemic, a simultaneous wave of COVID-19 and influenza infections, and can it be prevented? But first, we visit a group of graffiti artists in Zimbabwe. Their murals tell the stories of women and girls during the pandemic.
At the studio in Zimbabwe's capital, Harare, graffiti artists are working on concepts to help stimulate debate on social issues made worse by the pandemic. Their focus is on problems affecting women and girls. They first visualize their ideas with sketches on paper and on the computer before they set to work on the murals.
For us, it's a reimagination of our future, a reimagination of our contemporary life, and also going back to traditional knowledge systems. There's been a lot of, during the COVID times, we realized that we took herbs, we took concoctions that were used like 200 years ago, 300 years ago, that have been passed down through generations. So that showed us the importance of traditional knowledge systems.
The graffiti artists have been painting murals on the streets of some of Harare's poorest neighborhoods. Their imagery incorporates the faces of influential women. The hope is to inspire young women and girls who have been negatively affected by the pandemic. In Zimbabwe, the number of teen pregnancies rose sharply during the lockdown. Over 4,000 girls did not return to school when they reopened in early 2021. Girls and women's rights advocates say the arts are an effective way to communicate and to spark change.
Based on the learnings and experiences we've had from COVID-19, there needs to be a concerted investment in developing messages that are relevant, messages that are informed by experience and evidence, messages that harness the power of the arts, both the visual and performing arts, to propel messages around girls' rights, to propel messages that ensure the protection of girls, to also put forward messages regarding sexual and reproductive health rights and information.
The pandemic has also shaped Zimbabwe's urban street culture. Through the fashion collective Fabric Party, young people are exploring issues around identity that took a backseat during the pandemic.
During the COVID, we sat down, everybody had enough time to look into the internet and see what's going on. So we could place ourselves in that space. It was just random. But now after that, we're like, how do we identify or how do we create an identity for Zimbabwean street culture?
Fabric Party has developed into an art movement that brings together graffiti artists and fashion designers to explore new possibilities for collaboration.
When people spend 2 years locked down, we miss that element of a community, an element whereby you can collaborate and work as a collective. We used to do that during the COVID, we did it online. But soon after COVID, people realized the importance of collaborations and collective work.
At the height of the pandemic, the artists raised awareness of COVID-19 by painting murals encouraging people to follow health regulations, like wearing masks and social distancing. They drew on the star power of influencers, who they painted wearing masks. The artists plan to keep working with the concept to spark conversations about what humanity can learn from the pandemic.
Respiratory infections increased dramatically during the cold season. That was even true before the coronavirus appeared on the scene. the influenza virus in particular can lead to severe illness. Together with the rising number of COVID-19 infections, experts are warning of a so-called twin-demic, but it's possible to take preventive measures.
The global number of new infections and deaths due to COVID-19 has steadied since the end of August. For the past several months, the BA4 and BA5 Omicron subvariants have driven most new cases. But scientists say a number of worrisome new subtypes are also fueling the pandemic. In the US, but also other places, they include 3 types that together now account for around 1 in 7 newly reported cases there. In Europe, a lineage detected first in Asia has grown in prominence. In the UK, which has a top-notch surveillance system, experts are tracking the possible rise of still others. And Indian scientists and authorities across the globe are chasing data on a troublesome variant dubbed XBB. In Singapore, estimates show it could now be causing over half of all cases.
And as we come into the wintertime now, we are starting to see further increases in SARS-CoV-2 activity. And part of that is being driven, obviously, by these different Omicron variants.
And another infection is compounding concerns, the flu. Earlier in the pandemic, measures that slowed the spread of the coronavirus also helped people avoid getting infected with other pathogens, like those causing the flu.
Influenza, like SARS-CoV-2, is a respiratory infection. So the measures that were put in place to reduce COVID transmission also impacted influenza transmission. So when we reduced our mixing with other people, when we reduced our international travel, that also reduced the ability of influenza to spread.
But as the urgency of the pandemic subsides and measures relax, flu cases are also rising again. Both diseases pose a particular threat to groups like the elderly or people with underlying health conditions, and also to healthcare workers.
Although they may not be at elevated risk of severe disease, if they fall sick, then that also increases absenteeism from work, which has important implications then for the workforce and its ability to the healthcare system to operate. And of course, there's also potential risks that healthcare workers can infect their patients as well.
In an effort to head off the worrisome scenario of a twin-demic during the upcoming winter, healthcare authorities from the World Health Organization and other institutions are now spreading a simple message. Timely vaccination against both diseases can save lives.
So far, long COVID has been associated primarily with extreme exhaustion and physical pain. But researchers are also warning of hidden risks. More and more sufferers are experiencing depression and even suicidal thoughts. We talked to psychiatrist Leo Scher about the development.
Hello, Dr. Scher. Can long COVID increase the risk of suicide? Is there any data or evidence to support this?
There are no epidemiological data supporting a link between long COVID and suicide. However, many symptoms of long COVID are actually associated with suicidal behavior. For example, many people with long COVID are depressed. It has been suggested that at least 50 million people around the world with long COVID develop depression, and we know that depression is associated with suicidal behavior.
How might long COVID lead to suicidal thoughts?
Many studies over many years have shown that physical pain lead to suicidal behavior. It depends obviously on individual perceptions. Some people who have pretty severe chronic pain are not suicidal, while some people with relatively mild pain may become suicidal. Also, people with long COVID frequently have cognitive impairments, and many studies have shown that cognitive impairments are associated with suicidal behavior.
Could it also be related to neurological changes in the brain after a COVID infection?
There are suggestions that the COVID virus may induce a neuroinflammation, an inflammation in the brain, and it may affect mood, behavior, and obviously physical health. So yes, there is an idea that long COVID problems are related to neurobiological changes in the brain. In other words, long COVID may have a neurobiological basis.
So what does all of this mean for policymakers? What needs to be done to address the situation?
First, I would suggest that more research needs to be done. It is possible that long COVID is not really one disease, it's not really one condition, it may be a group of medical illnesses. It is very possible. Obviously, policymakers need to make sure that people with long COVID are getting appropriate medical help and obviously psychological help.
Thank you.
Thank you.
The coronavirus pandemic and the Ukraine war have made it clear how crisis-prone global trade is. Supply chains are collapsing while transport costs are rising dramatically. As a result, more and more companies are bringing back home production that was previously outsourced to other countries like China. The offshoring of past decades is turning into nearshoring, as these two examples from Argentina illustrate.
In December 2020, between the first and the second wave of COVID-19, the American giant Whirlpool and its president for Latin America, the Brazilian João Carlos Brega, decided to set up a washing machine factory in Argentina and export from there after a 20-year hiatus. The plant was inaugurated this October.
With the emergence of the pandemic and with the political repercussions that we are facing today, the need to make sure that the supply chain will not be broken if something happens far away has increased.
For the past few decades, the phenomenon of offshoring took place, by which industries from America migrated to China. During the pandemic, there was a shortage of freight. And with the war, fuel became more expensive. The new buzzword is nearshoring. An opportunity has opened up for those manufacturing nearby.
I have no doubts about that. But to do this, we also have to generate not just production, but knowledge. By manufacturing here in Argentina, we are bringing knowledge potential. This is how competitiveness is created. Competitiveness is not only about cost.
Whirlpool had just 160 employees in Argentina. Now there are 500. The company invested $52 million to produce 300,000 washing machines a year and exports 70% to Brazil and the rest to South America. It has also reinforced its presence in Mexico to supply the United States. Quite a few Argentine companies are taking advantage of nearshoring, like Ceramics Alberdi. Its owner, Martin Rappellini, says that between 2019 and today, it has quintupled its exports to Chile, Bolivia, Paraguay, and Uruguay.
We have pushed hard on Chinese and European products, with some targeting lower value products and Europe targeting higher value ones. Both the war and the pandemic had a big impact on the increase in logistics costs and also on inflation.
According to Rappellini, European ceramics companies have doubled the production costs due to the increase in energy prices.
China has had an impact, but the greatest impact has been on the logistics level. The containers that were around $2,000 before the pandemic now cost $20,000 to $25,000. Prices have dropped again, but they're still much more expensive.
Latin American countries with some industrial development, like Mexico, Brazil, and Argentina, can take advantage of export opportunities in a region traditionally focused on the extraction of raw materials. The economist and university professor Leandro Mora Alfonsín analyzes the phenomenon of nearshoring.
The reconfiguration of global value chains, whether it be nearshoring or friendshoring, started before the pandemic. What did the pandemic do? It accelerated everything because there was an increase in demand post-pandemic that supply chains were not prepared to respond to.
Mora Alfonsín cites a study by the Inter-American Development Bank that confirms that Latin America could replace 10% of China's exports to America. Argentina must reduce its 83% inflation, but despite everything, Whirlpool believes in its new factory. But they also hope that the cost of freight drops after the pandemic.
It's not yet at pre-pandemic levels, but it's not at the peak like it was during the pandemic. The market has restrictions, and the restrictions are very harsh. And that is why investment in nearshoring is continuing to accelerate.
The pandemic is still having an effect on the global economy.
Do you have any questions about COVID-19? Our science correspondent Derek Williams has the answers based on the latest research and analysis. Write to covidproducer@dw.com. This week he answers the question, does the data show that natural immunity is stronger than vaccination?
In Berlin, at least, it seems like everyone and their mother currently either has COVID-19, has just had it, or expects to have it soon, regardless of their immune status. I personally know people who've been vaccinated 4 times who subsequently tested positive for the virus. And I also know people who've had the disease 2 or even 3 times, even people who were up to date on their vaccinations. Omicron subvariants are simply really, really infectious. And the fact that COVID-19 is so widespread in so many places has made it impossible to provide simple answers to questions like whether natural immunity is stronger than vaccination. After all, most of us in 2022 now have our own long, highly personal history with SARS-CoV-2 and the vaccines that were developed to fight it. But even in the past, it was hard to nail down and compare the power of immune responses. Some studies conducted mostly during the Delta era suggested that disease-induced immunity was more powerful against that variant than vaccine-induced immunity was. But there were others that found just the opposite. There were also ones showing that the two are roughly comparable. The rule of thumb before Omicron swept in was sort of that being infected was roughly equivalent to a single dose of vaccine. But since it hit last winter, those variables have changed. The average person in many parts of the globe will by now, knowingly or unknowingly, likely have been exposed to Omicron and its family of subvariants repeatedly. It sounds unclear, I know, but there are things that the experts do pretty much all agree on. One is that attaining some level of prior immunity to COVID-19, whether it's through vaccination or through infection, that reduces the chances that you'll catch it in the near future, or catch it again in the near future, as the case may be. A second is that if you do get COVID-19, after previous exposure or vaccination, then it's a lot less likely to be severe. Number 3 is that most experts say that people who've been both vaccinated and infected, so what's called hybrid immunity, that they in general exhibit more durable and more potent levels of immune protection. And finally, there's one last point where the pros agree. Any prior immunity, they say, whether it's gained through infection or gained through vaccination, will provide some future protection from severe outcomes.
making face masks and protective clothing, collecting food and distributing it to those in need. The volunteers from the neighbourhood association Somos Tribu in Madrid lent a hand wherever they were needed during the pandemic and created a social network. The association received an award from the EU Parliament for its work. We went to meet some of the volunteers.
A familiar walk for Julia Oñate Moral as she makes her way into her neighborhood association. During lockdown, Palomeros became the headquarters for locals who rallied together to help their fellow neighbors.
Buenos días, chicas. Buenos días. ¿Qué tal?
They created an organization called Somos Tribu, We Are Tribe.
We began by coordinating all the help that was needed in our neighborhood, such as shopping for vulnerable elderly people, going to the pharmacy, or walking their pets. One day, a company contacted us and said that they had a batch of dairy products that they couldn't use. They asked if we wanted them, and we said yes, bring them over. They did. And then we distributed the milk and yogurt and so on.
Julia came to Somos Tribu every morning to help out before going to work as a lab technician in the Gregorio Marañón Hospital. At the height of the pandemic, the Marañón was overflowing with more than 1,100 COVID patients, with hundreds more turning up every day.
What impressed me was the silence. The Marañón Hospital is normally a loud and lively place, always bustling with activity. But during the pandemic, it was as quiet as a cemetery. And there was a kind of horror we'd never experienced before. Many people were deeply affected by what happened then, and still are. I worked in the emergency unit. We didn't have enough face masks when the pandemic hit. There just wasn't enough material for them.
Another founding member of Somos Tribu is Adriana Pop. She decided to act after hearing of shortages of face masks and protective clothing for health and essential workers.
I've always loved sewing, so I found some tutorials on how to make face masks. I used my daughter's bed sheets to make them. The first person who asked for a mask was a bus driver. That's when I started in earnest. I set up a WhatsApp group of women who knew how to sew. We got in touch with health workers who didn't have masks and gowns and got to work. We made these masks for fruit sellers and grocery store workers. These were nice for young people. We made these ones with cartoon characters for children. A lot of kids had a hard time understanding what was going on.
Adriana wasn't scared, even though she delivered masks to people working in essential services.
If a doctor became sick, many people would suffer, thousands. So I didn't think about myself.
One of the most important aids provided was the distribution of food to the elderly struggling with lockdown and families unable to go out because they had come down with COVID-19. Ana Escriba Fonteboa coordinated all the food that was packaged and sent out from Palomeras.
The few of us who had cars brought food to people's homes. Here's where we set up a food bank. Over there was a fruit stand. And over there was rice, lentils, things like that. At first we prepared more than 80 food baskets a day for families. That's a lot. Whole apartment buildings had come down with COVID. We left the food at the main entrance and the residents handed it out. We couldn't go inside elderly people's homes, so we left the food at their front door. Then we called them to say we'd brought the food. Our only contact with people was by phone. These are the flyers we first made with phone numbers on them. We put them in our cars so that the police wouldn't fine us for breaking lockdown.
The highlight for Somos Tribu was receiving the European Citizen Award from the European Parliament.
Brussels gave us the award. You can read about it online. Last year in March, members of the European Parliament came to a park nearby to give us their recognition. And in November, we went to Brussels to collect our award.
While Somos Tribu no longer exists, its legacy lives on in other groups that serve smaller neighborhoods in the Vallesas district of Madrid. The center at Palomeras is a resource that supports vulnerable women, but they still distribute food to the elderly and help people who are suffering the impact of long COVID.
That's it for today. See you next week on the COVID-19 special. Till then, stay healthy.